Today you will be seeing two cases. One, a patient for whom we are going to do gynecomastia surgery, and for the second patient, along with gynecomastia surgery, we're going to do liposuction of the abdomen and flanks. Many a times we have noticed patients who come for these gynecomastia surgeries. They have poor chest hair growth, they have very sparse beard and very specific localized fat deposit in the flanks. These are specific characteristic features of estrogen dominance. When the estrogen activity is dominant, that's when your chest develops. Need not have a high value of estrogen in the blood, but even estrogen dominant, that is the ratio between testosterone and estrogen, when there is an imbalance, the estrogen features dominate, like development of the chest, reduced chest hair, sparse beard or no beard, and specific flank deposits, just like a beautiful waist, like a hourglass. So these are characteristic features which men don't like. So we combine correction of the chest as well as contouring the waist together. So today you will see two different patients, one for whom we are going to do specifically only the chest, and another important point is not all gynecomastias surgery is done exactly the same way. Some of them have more fat deposits throughout the entire chest. Some do not have much of fat deposit because they've worked out and reduced and specifically have only the gland. In those patients, if you go and do a complete aggressive liposuction in the upper chest, you might end up injuring the muscle. And there are other patients for whom, because of high grade development of the breast, the skin sags, and hence they will also require some skin tightening. So each patient who come for gynecomastia surgery, they are different. Some will require only gland excision, very rarely. Most will require liposuction with gland excision. And for some, we add what we call ultrasound assisted liposuction when there is more fat and we want a little bit of skin retraction. And for the last category who have really excess skin, we also add invasive radiofrequency skin tightening. So join me, watch both these procedures as me and my team will be simultaneously performing both the procedures. Thank you.
I love the chase and the hunt, and I set the pace when I'm running. I always take what I want and I always give it one.
In this patient, he's got a very small gland, not much of fat in the surrounding chest. So we've already assessed that pre-operatively. So if you see this particular area, we make one small port here. So that's one small port. We make a small hole in the skin. If you see, it's tiny little hole, not a big hole. So we just make a small hole. Then, so this instrument, this is a power assisted instrument. We call this handpiece. This is from a company called Microair. So that's a handpiece. So basically this is called a cannula. It's a tube. It's just 4 millimeter in size, and you can see there are holes in the tip. So this is where the fat is sucked in. First, now what we do is called tumescent infiltration. We are going to put, you can see the bag filled with saline, and it's also got some adrenaline which will reduce blood loss and constrict the vessels. So along with some local anesthesia solutions, all of that is just infiltrated in this area, and that is what is the first process. So we just put this cannula inside. Okay, start. So we infiltrate this fluid. So we just push in this fluid so that the gland is lifted up. Vibration here, if you see this, the cannula moves up and down, and as well as it moves forward and backward. Now many a times in many places they do liposuction without this vibration. So the advantage of using this is that with minimal time, more fat is sucked out and less trauma to the tissues, because you don't force, automatically it grinds, and also the amount of vibration can be altered depending on how much fat we want to remove and what's the thickness of the fat pad and so on and so forth. So this is called a power assisted liposuction. So that is what we will be using today. So you can see the fat being sucked out. Absolutely, there's no bleeding. So the fat comes out smoothly. So first we will level the whole chest. We remove all the fat and we level the chest all throughout. So this step is called the liposuction. So first step was infiltrating tumescent. Second step is liposuction, and it's done for all the patients except for someone who has specifically only gland. So we remove the fat throughout. Otherwise, if you remove only the gland, the center of the chest goes inside like a saucer. And while doing this, it's very important to not remove any muscle. So in this patient, he's got a very well developed pectoral muscle. So we just remove the fat in the lower part and just tether, remove the fat just to shape in the upper part, not much. So the third step now is we're going to remove the extra gland. So we make an incision along this black line, which is hardly, it's not visible at all after surgery. You'll see after we close. So basically, practically no scars will be visible. So this is what we call the gland. So you can see these are tough tissues. This will not come with liposuction. You'll be abrading a lot of tissue if you're trying to remove through liposuction, and neither will it melt through ultrasound or laser. So that is why this gland is removed. Unless you remove this gland, the chance of recurrence is very high.
Hello everyone. So today we have a 25-year-old gentleman. So he's come with the main complaints of enlarged bilateral breast, and also he's come with complaints of localized fat deposition in his abdomen, upper and lower abdomen, and also in the axillary area, and also in both flanks. So today we are mainly going to do what the gynecomastia surgery. We're going to give him a good contour to the chest, and also we are trying to debulk the abdomen. So he's not a candidate for high definition because he's got a lot of intra-abdominal fat as well. So we just try to give him some kind of basic definition. So basically we are going to just debulk the abdomen and the flanks, and to get him a better contour.